This is my student support system. Keep watching, keep learning.
Community Health Center is a health facility which covers a population of 80,000 to 1,20,000. 80,000 population in hilly, tribal and backward areas, while 1,20,000 population in plain areas. It is also known as first referral unit. Many times this question comes in exam. Which is the FRU? It is Community Health Center and serve as referral center for 4 to 5 primary health centers. Round the clock services starts from the community health center level. A community health center is equipped with at least 30 beds for inpatient services. Staffing pattern. At community health center, at least 4 medical officers are there. 7 staff nurse or nursing officers are there for round the clock health services. 1 pharmacist, 1 lab technician, 1 radiographer for X-ray services, 2 ANMs, 4 data entry operators, 1 dresser, 1 driver and 3 MTS staff. So total 25 staff should be there at CHC. Now we come to the functions of CHC. Functions of community health center includes routine and emergency care in medicine, routine and emergency care in surgery, 24-hour delivery services, obstetric care including LSCS operations, full range of family planning services, child health services that includes routine as well as emergency, basic laboratory services including X-ray, ambulance and transportation services, implementation of all national health programs. Community health center provides inpatient services to the patient with provision of at least 30 beds. Emergency newborn care. Community health center is also known as first referral unit.
My student support system. Keep watching, keep learning.